So we wanted to ground some of the discussion in the serious facts, in the urgency. Most of you know it, but one of the jobs of this conference is to blend issues that have been considered externalities to some people that we haven't been paying attention to. We're grounding this in public health. Instead of building infrastructure that winds up costing us in ways that we don't even know, the switch, instead of indicting those who built it, the metaphoric switch that we're doing is bringing public health, our bodies, the people who represent our well-being, to the table. So infrastructure is designed right. So they're part of being the client rather than the person who sues. And that means we're all the client. A real hero in public health who's come back to Los Angeles from working all over the country is Dr. Dick Jackson, MD, MPH, Professor, Chair of Environmental Health Sciences at the School of Public Health of the University of California, Los Angeles, UCLA. He's just launched that new program there. He's a pediatrician. He's a public health leader. He recently served as a professor at University of Michigan, Ann Arbor, and at UC Berkeley. He served in many leadership positions with the California Health Department, including the highest, the state health officer. For 9 years, he was director of the Centers for Disease Control and Prevention, National Center for Environmental Health in Atlanta. In 2005, he was recognized with the highest civilian award for U.S. government service, the Presidential Distinguished Executive Award. Dick is an indefatigable battler for us. Dick.
This is very intimidating to go around this room and recognize both the depth of each of the individuals and the breadth of the group that's in this room. And I thought about the folks that worry about human exposures related to waste issues, and you're measuring what's in waste streams, and those who are worried about water, we measure what's going on in water, and those who worry about air measure what's in air, and those who worry about food measure what's in food. But the ultimate integrator of what is going on in our environment is in many ways the human body. And so when I was at CDC, we worked very hard to put in place a biomonitoring program to actually measure toxic chemicals in blood, in urine, because the human body is the integrator of the exposures that we are looking at. So it is presumptuous for me to be the speaker at the beginning of such an illustrious meeting, but we've got to start somewhere. So let me talk a little bit about how health pulls together all these disparate strands. My dad's cousin lives on a house on the coast of Maine, and underneath the house there's a watermark, and it says Halloween 1991. That was the so-called perfect storm that was made famous. The reason it was a perfect storm was there was an immense storm coming across west to east that hit the Gulf of Maine, typical storm, but there was also a small hurricane coming up the coast of the United States, and there was a northeaster coming down from Labrador and Greenland, and they collided over the coast of Maine and created this colossal storm. I think we are in the face of a perfect storm in the 21st century. But it will be health and social issues from one direction, it will be economic issues from another, and it will be environmental issues from the third. And 20th century inside the silo thinking will not succeed in turning around the challenges of the 21st century. And that's why I welcome this meeting, because it's a chance to integrate lots of different disciplines to face this. From a health and demographic standpoint, I don't need to tell any of you, and one of you is from 2050, what's the predicted population of California in 2050? It's about, what, 50 million? 54 million, and about 100 million potentially by the end of the century. The nation will be about 600 million people by the end of the century. The population pressures will be enormous, with substantial numbers of elderly who will not be contributing to the economic workforce to the same degree that we were when we were younger. I was a young physician at the same time as Linda Rudolph, when we were at UCSF. And Linda, we thought that 7% of all the money in the United States going to medical care was a staggering amount of money. 7% of all the money in the United States. What is it now? 16, 17% of every dollar in the United States? Did you see the article in the New York Times earlier in the week about the manufacturing sector of the United States and the decline of the manufacturing sector? Do you remember that we are now the lowest manufacturing percentage country of the developed countries above France? We are now at about 14% of all the money in the United States being generated out of manufacturing. So the health sector is now consuming more. In fact, 40% of all the new jobs generated in the 21st century, and I misspoke because I said health, and it's not health, it's medical care that's absorbing these enormous amounts of money. We are going to have to begin to turn this around. You would think with all this money that we're spending that we're tremendously healthy. And as the President pointed out last night at his magnificent press conference, we're really looking at declining health status. We have counties, large numbers of counties in the United States, that are looking at declining lifespans, despite the fact that we're spending $1.06 in the United States on medical care. Now, part of this epidemic that we're looking at of health impacts is one that was actually, I was fascinated by this. Did you notice in the New Yorker, Elizabeth Colbert had this article on the fat epidemic, and she ascribes it to lots of things, and I'll go through it, but here's the prevalence of obesity in the United States. Here's 1991, California, 10 to 14% of our population being obese. By 1997, a new color, over 20% of the people in Indiana, and by 2000, California at 15 to 19% of our population being obese. By 2004, 20 to 24% of our population, and by 2005, you can see a brand new color, a dark red color appearing, over 30%. Here's California, still at 20 to 24%, but over 30% of the population obese in the United States. Average adult in America has gained 27 pounds, male. Average 11-year-old boy has gained 11 pounds since 1973. Average 16-year-old girl has gained 16 pounds since 1973. Now, being obese, being overweight is bad for us. It's bad for our blood pressure. It raises our risk of stroke, of heart disease, of gallbladder disease, of liver disease, of joint disease, of having a baby with a birth defect, and a series of other problems. But the big risk it entails for our population, huge costs, is diabetes. We have been looking at a doubling of diabetes in the United States over the last 20 years. This is a technical slide, but I just want to point it out. This is my body mass index is about here, so I'm about 4 times the risk of becoming diabetic as a male. If I were a woman, it would be about 15 times the risk of becoming diabetic with a body mass index of 27. If I were obese in the mid-range, I'd have 11 times the risk. If I were a woman, 40 times the risk of becoming diabetic. If I'm morbidly obese, I would have about 100 times the risk if I were a woman. As your body mass index goes up, your risk of becoming diabetic goes up. Why am I talking about this? Diabetes is, look at the epidemic of diabetes in our country. By the way, it's tracked right along in our population, diabetes with obesity. Here's diabetes in 1994. California, the colors aren't quite right, but less than 4.5% in 94. By 2001, we were up close to 6%, and by 2007, we're at about 8%. We are now spending 1.5% of all the money in the United States on diabetes.